Welcome to the Point of Care Testing lecture. Point of Care Testing refers to any pathology analytical process performed for patient care outside the laboratory. It is usually performed by non-laboratory staff at the patient's bedside. Provide quick, accurate results which are comparable to the results obtained by the laboratory department. The following are the point-of-care devices. A Q-check-in form from Roche for random blood glucose. Path Fast Cardiac Analyzer from Mitsubishi for cardiac markers. ABL90 Flex for arterial blood gases. Urine test strip for chemical test for urine. The following duties must be done for the implementation of POCT. Approval of the purchase of all new POCT machines. Ensure that regular maintenance, personnel training and quality control measures are applied to all POCT machines. The following must be included in the training program: collection, transportation, and disposal of specimens. Quality control requirements. Step-by-step procedures. Recording results. Interpretation of results. Troubleshooting. Maintenance of equipment. The acute check-in form for blood glucose monitoring requires a time of 5 seconds, blood of 0.6. The result will be a wireless transfer of data. The acute check-in form for blood glucose monitoring composed of device, dock or base unit hub, strip, lancet, and the controls. The following are the procedures needed for equipment and supplies. A Q-checking form meter, store away from direct sunlight. Do not expose meter to extreme temperatures. The acceptable range for using the meter is 14 degrees Celsius to 40 degrees Celsius. For the Q-check base unit that is used to recharge the glucometer battery pack, provide a route for transferring data or configurations through a serial port. The glucometer needs to be docked at all times when not being utilized for testing. Do not expose the base unit to water. For the disposable lancet device, always follow standard precautions and dispose of lancet device according to hospital infection control policy. For the test strip, keep test strips in the original capped vial. Replace the cap tightly and immediately after removing a test strip. Store the strips at room temperature. Do not freeze the container of test strips. Use the test strips within the recommended expiration, use by date on the test strip vial. Each time a new strip vial is opened, a QC, quality control, must be performed. Use the test strip within few minutes after taking out of the test strip vial. Use the test strips in an area with less than 85% humidity. A Q-check Comfort Glucose Control Solutions, 2 levels. Bottles of controls must be dated and initialed when they are first opened. Once opened, bottles of control may be used for the shorter of 90 days or until the manufacturer's expiration date. The following must be done for quality control. QC done every 24 hours. QC is consist of 2 levels. Record the date of opening on the vial. Pass, if within acceptable range. Fail, if outside acceptable range. Check the table for the reference range and critical values for the glucose of adult and newborn. Check with your unit preceptor regarding the complete process according to hospital policy in using a Q-check for the blood glucose monitoring of your patient in the units. The trained staff who will use this should remember that lancet is auto-disabling single-use. Device must be in the base unit when not in use. Device lockout within 96 hours not in the base, or 24 hours QC not done. Device turns off after 3 minutes. Always turn the meter off before placing it back into the docking station. Don't expose strips to moisture. Never enter any number or patient's MRN, scan the visit number only. For troubleshooting, please note that If for any reason your meter doesn't respond in the appropriate manner, example barcode scanner does not work, meter does not turn on, unfamiliar error codes and other device issues, call the point-of-care coordinator on extension number 3123 or 3152. For backup procedure, if the glucometer or test strips are unavailable, a venous blood sample must be obtained and sent to the clinical laboratory for testing. PathFast Compact Immunoassay Analyzer for cardiac marker, the following are required. A time of 15 minutes sampling material. Whole blood in EDTA or heparin from lavender or green top. Sample volume in wells is 100. Consumables are kit, PathFast tip, paper roll, waste box. Parameters checked: CKMB, troponin, myoglobin, D-dimer. When to run the calibration. Introducing new assay item. New reagent lot. Calibration is expired. Calibration is done every 28 days. QC is out of range. When to run control QC is expired. QC in 24 hours. After calibration. Erroneous sample results. All controls must be stored inside the refrigerator with 2 to 8 degrees. Specimen collection and requirements. Whole blood in heparin or EDTA. Analysis must be within 4 hours. Don't use clotted and insufficient sample. Specimen must be labeled. Reagent storage and handling. Do not use reagents beyond its labeled expiration date. Handle the reagent cartridge by plucking at edge of it and do not touch the aluminum seal and the black well with your fingers. When the reagent cartridge is dropped and damaged, do not use it. Avoid contamination of saliva in the black well. Avoid contamination and exposure to direct sunlight. Store at +2 to +8 degrees Celsius. Do not open the cartridge tray until immediately prior to use. In specimen collection, whole blood, plasma collected with standard sampling tubes containing heparin or EDTA. Whole blood samples must be analyzed within 4 hours after collection. EDTA and heparin plasma sample stability. +15 to +25 degrees Celsius is 6 hours. +2 to +8 degrees Celsius into 8 hours. -20 degrees Celsius in 3 weeks. Remember, freeze only once. Avoid clotted and insufficient amount of samples. Attach sample label to tube. Check the reference range and critical value in the table presented for CKMB troponin, myoglobin D-dimer. Remember, do not take out kits from the refrigerator if you are not running a test. Only use blood from a lavender or green top tube. Do not run tests that are verbally requested by the physicians. Tests must be entered in the system. Always scan the specimen barcode. Do not use MRN or visit number. ABL90 Flex Analyzer for arterial blood gas requires a time of 35 seconds, sampling material, ABG or VBG in special heparinized syringe. Sample volume is 65. The consumables include solution pack, sensor cassette, thermal paper, safe pico syringe. Check the following parameters. Specimen collection and requirements. Only calcium titrated, balanced heparin or lithium heparin should be used as anticoagulants. Air bubbles in the specimen should be considered a contaminant. No special patient preparation is necessary. For radial artery sampling, the clinician or operator drawing the sample must assess collateral circulation if the patient is deemed to be at risk for injury. This should be documented in the medical record. Equipments and materials. With the sensor cassette. Each sensor cassette is stable for 30 days after installation on the system when installed by the install date. Sensor cassette are recommended to be stored refrigerated at 2 to 8 degrees Celsius. Sensor cassette can be installed on the system directly from the refrigerator. Solution pack. The solution pack storage temperature ranges 2 to 25 degrees Celsius. Calibration and quality control. In calibrating, the analyzer automatically performs a 1-point calibration with every measurement. A 1-point calibration is performed on the Cal1. A 2-point calibration is performed every 8 hours using 2 solutions from the solution pack. In quality control, 2 levels of automatic QC are performed every 8 hours of patient testing following manufacturer's instructions. Note that in calibration and quality control, any sensor failing QC at 1 or more levels, the system will automatically repeat it. If the problem remains, the parameter is automatically disabled by the analyzer, auto-locked, and will not be available for patient testing until the errors are resolved. Disabled parameters can only be reactivated following successful recalibration and repeat QC. Check in the table the following test with their specific reference interval if from arterial or venous samples.
The purpose of this video is to demonstrate proper use of the Radiometer SafePico self-fill arterial syringe. By observing its use in the clinical setting, you will have a better understanding of the proper use of SafePico self-fill syringe and the benefits of the syringe when used as radiometer intended. Be sure to use universal precautions as designated by your hospital, as each hospital has their own specific procedures and guidelines. Identify your patient. Prepare your patient according to your hospital's protocol, including an Allen's test. Prepare your supplies. Remove your supplies from their packaging or from the kit. Set the safe tip cap to the side, but within easy reach. Prepare your patient's draw site according to your hospital's protocol. Twist the syringe wings 90 degrees to confirm a tight fit between the syringe and the safety device. Test to make sure the safety device moves easily. Preset the self-fill syringe to the desired fill level by drawing the plunger back to the desired mark on the syringe. Expose the needle shaft by holding the barrel with one hand and pulling the needle sheath straight off without twisting with your other hand. The needle has a surgically sharp, short bevel to minimize the potential for opposite arterial wall puncture and offers a faster fill time. This makes the arterial draw as comfortable as possible for the patient. Begin your arterial sample draw. Adjust your line of sight to look over the needle hub for a better view of the blood flash if needed. Once the sampler is full, remove the needle and apply constant pressure to your patient's arterial puncture site. Holding the sampler in one hand, place your thumb toward the back of the safety device thumb plate, and without pressing down on the plate, gently slide the protective shield over the exposed needle until a click is heard. The click signifies that the protective shield is locked in place and the needle is no longer exposed. Remove the needle and needle safety shield device by holding onto the syringe barrel wings while twisting the needle shield device. Discard in a sharps container. Firmly place and twist the safe tip cap 1/4 turn onto the syringe. Hold the syringe vertically so the safe tip cap is at the top. Gently flick the syringe barrel so that any air bubbles will rise to the top. Press the plunger slowly to expel the air through the vented safe tip cap. You will see a red band form in the tip cap and feel resistance in the plunger, indicating the air has been removed and you now have a sealed anaerobic sample. The sample is now ready to be mixed. The integrated mixing ball in the aspirator helps accelerate mixing with the electrolyte-balanced heparin and minimizes pre-analytical errors due to an incompletely mixed sample. An incompletely mixed sample can affect test results and patient treatment. Check the arterial draw site and apply a pressure bandage to the puncture site according to your hospital's protocol. Label and transport the arterial sample according to your hospital's protocol to the blood gas analyzer for analysis. The pre-barcoded syringe offers a unique identifier that can be used at the bedside to link the patient and the syringe using Radiometer's Radiance and FlexLink software.
The ABL90 Flex blood gas analyzer is mobile and can operate on battery and is ready for wireless connection to hospital IT systems. It measures 17 parameters in only 35 seconds on only 65 microliters of blood. To measure a blood gas sample on the ABL90 Flex analyzer, all you need to do is place the sampler in the built-in sample mixer. The sample is fully mixed in 7 seconds. Scan the sampler barcode to retrieve patient and sample information electronically or enter the information on the touchscreen. Open the inlet and place a sampler to aspirate the sample. The result is ready in 35 seconds and will electronically be transmitted and printed after 35 seconds. The self-cleaning inlet handles both blood gas samplers and capillary tubes. The inlet probe is always covered, avoiding blood exposure to the operator. The analyzer has only 2 consumables, a sensor cassette and a solution pack. Let's look at the sensor cassette. This sensor cassette contains all sensors and is based on thick film technology. The sensor cassette is ready to use and is very easy to replace. The solution pack contains all solutions needed by the analyzer and is also collecting all waste for later disposal. The solution pack contains 3 calibration solutions and 3 quality control solutions. As you can see, the ABL90 Flex analyzer is a very flexible and easy to operate blood gas analyzer. Even replacing sensor cassettes and solution packs can be done very easily. We hope you have enjoyed this short demonstration. Please contact your Radiometer representative to schedule a live demo.
Always enter patient data by scanning patient SID or visit number, choosing correct sample type. Take note, never use a sample taken from a test tube, especially lavender tube, because it can cause a false increase in potassium and other parameters. Use safe pico syringe only. Clean the machine with 70% alcohol except for the screen. A dry gauze should be used. If test is delayed, make sure to place sample in ice. In doing the urine test strip, the following are required. A time of 60 seconds. Sampling material, freshly voided urine. Sample volume, 5 to 10 milliliters. The following parameters can be checked. Blood, bilirubin, urobilinogen, ketones, glucose, protein, nitrite, leukocyte, pH, and specific gravity. QC needs to be done and recorded when patient's testing is done. If the QC is questionable or unconfirmed, make sure it is repeated and a corrective action is done before patient's results are reported. Take note of the following in handling and preparation for urine test using urine test strip. Collect freshly voided urine in a clean, dry container. Mix the sample before testing, and test it within 2 hours. If unable to test within the recommended time, refrigerate the specimen immediately and let it return to room temperature before testing. Store the strips bottle at temperature as indicated on test strips bottle. Do not use the strips after their expiration date. Do not store the bottle in direct sunlight, and do not add preservatives to the urine. Do not remove the strip from the bottle until immediately before it is to be used for testing. Replace the cap immediately and tightly after removing the reagent strip. Do not touch the test areas of the strip. In testing, dip all the test pads of the strip into the urine, and immediately remove the strip. If reading the strip visually, start timing. Drag the edge of the strip against the container rim to remove excess urine, and blot the edge on a paper towel or tissue if using the analyzer. It is not necessary to blot if reading visually. If reading visually, compare each test pad to the corresponding row of color blocks on the bottle label. Read each pad at the time shown on the label, starting with the shortest time. Hold the strip close to the color blocks and match carefully. Read the pads in good light. The results of patient sample are recorded in the medical record, nursing triage assessment. The result must be legible and complete. For the reference range, in the urine, normally no hemoglobin is detected in the urine. Normally no bilirubin is detected in the urine. Urobilinogen is normally present at concentration up to 1.0. Ketone normally no ketone is detected in the urine. Glucose small amounts usually between negative and 100 are normally excreted. Protein lesser than 10 is normally excreted. Nitrite normally is not detectable in urine. Leukocytes normal urine specimens generally yield negative result. The normal pH of urine can range from 4.6 to 8.0. The normal specific gravity of urine can range from 1 to 1.03. For safety, all material should be considered to be a biohazard. It is therefore important that all samples should be handled with suitable gloves, and that appropriate precautions are taken when handling the material using universal precautions. Dispose of all waste material in the appropriate waste container. Thank you for participating in our online lecture regarding POCT, diagnostic test done in the nursing units.